Mr. Chairman, this bill works to ensure localities have more federal support for school-based services. The way that school-based services work is that localities pay 100% of those services, and then they send a cost-based appraisal or assessment to DMAS, who then takes that bill. It does not run through the managed care organizations. This is a different vehicle through DMAS. DMAS then draws down those funds at 50% ratio from the federal government and passes them through back to the locality. Virginia doesn't pay the 50% co-payment of the Medicaid expenses for school-based services. The localities do, but they front 100% and then draw down. Currently, the Virginia state plan limits the ability of schools to assess those value assessments or cost-based assessments to school-based services that are designated by an IEP alone, an individualized education plan. The federal government several years ago opened up the permissibility that schools that were offering school-based services for any Medicaid-covered child could actually bill and be reimbursed from the federal government for those services, even if they did not have an IEP, but Virginia never changed her state plan. We have to change the language in the state plan to enable this to happen. There's a couple of other components to this bill, and the amendments that you see before you in the substitute are a way to, really supported by DOE and DMAS, for us to language this better. And specifically, they work, and maybe Julia could read for me. There's a federal code that dictates what can be reimbursed. And we were attempting in the original bill to list what those services were and expand them to include applied behavioral analysis, which is for autism. But we found out that if we just reference this federal code, which describes what can be covered, we're making it much more permissible, and we're not making a mistake by inadvertently omitting a particular service. So, Julia, could you read that for me, please?
Mr. Chair, Senator Dunnavant, the federal code section that you are referring to is Section 1905R of the Federal Social Security Act.
And the services are EDP. Could you read that, please?
Sure. It's early and periodic screening, diagnostic, and treatment services.
Thank you, Counsel. The other component to this bill, Mr. Chairman, is that it allows schools to charge a telemedicine originating site fee. And basically, in order to provide telemedicine, you have to have approved telemedicine equipment that preserves privacy and follows HIPAA laws, etc. We have all the other components of really providing things like behavioral health, behavioral services or therapy, as well as mental health services, depression, whatever it is, even connecting to a pediatrician's office, except that the school cannot meet that high threshold for the materials to have the appropriate equipment. The way that everybody else in the medical community covers the cost of that equipment is that they charge an originating site fee. And by allowing this to happen, schools who already have the permission to provide telemedicine would be able to expand those services to providers who are even outside of the school if they didn't have the resources within the school. So, Mr. Chairman, this does have a fiscal impact. Most all of the costs that I have just described, everything I've just described, is non-general fund because it all comes from the federal government. But Virginia will have to develop some guidelines for this. And one of the challenges we've had with school-based services is the quality of those school-based services, and are they actually evidence-based in their development and application? And number two, do they improve the outcomes for children? And DMAS is going to develop oversight to ensure that those two things happen so that once we do diagnose, we can get our kids to performance. We want to remove all the obstacles that they have to learning. And there are a multitude of obstacles we've addressed before because of all the other social determinants of health. And Mr. Chairman, that is the bill, and I'm happy to answer any questions.